Welcome everyone to the Extreme Heat Event Response presentation for the Home Support Team. Before we begin, Interior Health would like to recognize and acknowledge the traditional, ancestral, and unceded territories of the Kikal Dene, Ktunaxa, Inkalkatma, Shewepem, St'át'imc, Syilx, and Chilcotin nations where we live, learn, collaborate, and work together. In response to the 2021 extreme heat event, the Ministry of Health has asked all health authorities to develop a process to identify those who are extremely vulnerable and to increase wellness checks during times of extreme heat events. At the end of the session today, you should be able to describe the extreme heat event screening process, perform your role as part of the process, and be able to state the purpose and benefit of performing heat event screening checks. In preparation for seasonal readiness for extreme heat events, a standard work document has been created to help local teams quickly identify their vulnerable clients and support them to alleviate heat-related illness during the event. This standard work document provides step-by-step responsibilities for all home support team members, including team leaders and community healthcare workers, when a heat event has been announced. So let's take a look on the next few slides what those roles and responsibilities are. When the heat event warning has been issued, a number of things will happen simultaneously. A member of the Home Support Transformation Team will notify the Procura team to activate the extreme weather screening questions for the CHWs on their cell phones. And the transformation team will let the mobility team know that they need to send out the mass text to the CHWs informing them of the heat event. When the heat event notification comes out to the managers, they must inform their team leaders. This is the same notification process as it is for evacuations due to fires and floods. Once this occurs, the team leader would be responsible for sharing resources with CHWs during morning huddles, including the standard work document that we just looked at, hazard information related to heat stress for employee safety precautions and awareness, a thermal exposure safety huddle document about heat stress, a home health newsletter discussing heat-related wellness checks, and the BC Government Extreme Heat Preparedness Guide, which is an excellent resource for everyone. The team leader must also remind the CHWs that they will be receiving a text message on their cell phones when the extreme heat event has started, and review with the CHWs on how to complete the extreme heat event screening questions. Community healthcare workers will receive a text message that the heat event has started, and they will begin to see the heat event screening questions show up on each client visit. CHWs are responsible to ask each client the extreme heat event screening questions at the end of each visit. Depending on the client's responses to those questions, the CHW will report concerns about the client to the program clinicians. On the next several slides, we will review how this will look on the phone. So first, complete all other activities for the client on the phone first. Then, the extreme heat wellness questions will show up for the CHWs, and they will need to complete the screening questions before they are able to complete the visit. This is how the questions will look on the phone, and this is the first question. You can see that if the answer is no, you don't need to do anything. If the answer is yes, you need to report that to the program clinician. The answers to the questions will determine whether you need to contact the program clinician or not. So let's take a look at another example. In this example, if the answer is yes, then there is no action required on your part. If the answer was no, then you would need to contact the clinician. So let's review all of the questions and the instructions. The first question, is the current indoor temperature above 26 degrees Celsius or 78.8 degrees Fahrenheit? If the answer to that is yes, then you need to make voice contact with the program clinician. Is the client sweating, having muscle cramps, headache, dizziness, upset stomach, rashes, extreme thirst, hot to touch, or new confusion? If yes, you need to make voice contact with the program clinician. The third question, do you have enough food and fluids for the next several days? If no, make voice contact with program clinician. Do you have enough medication for the next several days? If no, make voice contact with the program clinician. And the fifth question is your home too hot for you to be inside? If yes, make voice contact with the program clinician. When all of the questions have been answered, there should be a green check mark next to each question. Then you can complete the extreme heat wellness check at the bottom of the screen and complete the visit. When the heat event has been canceled, you will receive a text message that the heat event is now over, and the heat screening questions will no longer appear on your phone. You will now stop asking the heat event screening questions after the visit with the client. Now, if you have any questions, please contact your home support team leader or manager, or you can send a message to the Home Support Transformation team. Thanks so much for listening to this presentation.